care! Raise up! Home care! Raise up! Home care!
Hi, my name is Troisi. I'm an organizer with United Home Care Workers of Pennsylvania. We're here today in sunny Scranton, Pennsylvania on Friday, August 22nd to advocate that Harrisburg pass a fair budget that includes $21 million investment in participant-directed home care workers to raise that workforce above $15 an hour for the first time ever and to give those workers some paid time off. This is a critical workforce providing essential care in our communities to keep children, seniors, and people with disabilities aging, living, and participating at home and in their communities with dignity. Let's get it done.
Thank you so much for being here on this beautiful sunny afternoon in Scranton, Pennsylvania. But we actually don't want to be here today. We are here today because every single day, every single hour, every single minute, the state budget is not passed. People in Pennsylvania are suffering. And we're here today to specifically spotlight the importance of participant-directed home care services in our communities and to highlight the need for a $21 million investment in that critical care for our communities. Home care workers take care of the most vulnerable people in our communities. Often they are children, they are seniors, they are people with disabilities who want and need to stay in their homes, living, participating in their communities, and aging with dignity. And that is more important than ever. And yet, as you'll hear from home care workers today and others, that workforce is grossly underpaid. The $21 million investment we're asking for would raise wages for all participant-directed home care workers across the state and provide the first paid time off ever. Thank you, State Representative. And so we wanted to hear directly from some of those home care members and those critical home care givers today. And we're proud to be joined by our allies here that I will sort of introduce as I call you up to speak. First, I'm going to pass it over to Krysten Xanthis, who is a home care worker right here in Scranton, Pennsylvania. Krysten?
Good afternoon, everyone. My name is Krysten Xanthis from Scranton. I became a home care worker at a young age when my family members needed me. My grandmother was at home in a hospital bed in a coma. I love the job I do, but it takes a lot of patience. Right now, I take care of a lady who lives alone. Her only son lives in California. Unless she has an aide in her home, she has no one to talk to. Imagine waking up not knowing in your whole day if you will have someone to talk to. How would that make you feel? That's why I love being a caregiver. Disabled and elderly people deserve to have someone to talk to and deserve to be taken care of just like everyone else. Like many working people, I am worried about cuts to Medicaid and SNAP benefits. I myself, along with many other people, use Medicaid and SNAP. I'm afraid I won't be able to get into a doctor due to the cuts over time that are being made to Medicaid. I won't be able to get the physical therapy that I need. As of right now, I was told that it's cut to 2 days a week instead of 3. As a caregiver, I get paid $11.20 an hour. During the pandemic, department store workers were getting paid $15 an hour. That was 5 years ago. I ride the bus with another caregiver. There are times that I cannot afford to take the bus one way. One-way bus ride is $1.75. I cannot afford a car because I cannot afford to live, to go to the grocery store, so I cannot put money down on a car, on a used car. With cuts to Medicaid and SNAP, everything going up, how will caregivers like me afford to do our jobs and take care of people who need it? I'm speaking up because home care is a real job. It is not simple work. There are no breaks. You either get your breaks sitting in the hallway in a chair for a few minutes or standing in the laundry room while you're waiting for the laundry to be done. You don't get paid time off. Today, I was asked if I was able to work in the morning because somebody wasn't able to come in. I wasn't able to due to my knee. Tuesday, I didn't work I had the day off. I didn't get paid because I had the day off. We aren't treated as essential workers, but we are. It's not right. Politicians aren't working for the people. If Rosemary Brown woke up tomorrow and an elderly family member needed help, would she do it for $11.20 an hour? No. In my opinion, she won't. No one will. No politician would do that for $11.20. Not many people would. Because that's why she's saying she voted for a flat-funded budget with no investment in home care. Shame. Shame. You need to look at reality and see, God forbid herself, if she woke up one day and she needed it aside from a family member and she wasn't able to walk, what would she do? Caregivers like me deserve better, and I'm standing here as a proud union member of SEIU because we are stronger together. We can hold our politicians accountable. Thank you.
Awesome. Hold politicians accountable. That is important. And there are plenty we need to hold accountable, including Senator Rosemary Brown and Senator Lisa Baker, who just voted for a flat-funded budget, which we know is not only denying the investment that we need, but taking us backward. But we have some of the good ones here with us today. And I'd like to call up State Representative Kyle Donahue, one of our home care champions in the state legislature.
Thank you, and thank you all for being here today. We're gathered here today because our caregivers, our patients, and communities deserve better. On August 12th, Senate Republicans voted for a flat-funded budget, one that fails to meet the needs of Pennsylvanians and shortchanges the essential work of caregiving. The vote was a failure of leadership. We are calling on Senate Republicans to do their jobs, pass a real budget that invests in the people who keep our state running. Every day this budget is delayed, Pennsylvanians will suffer. We should be increasing investment in care, not cutting corners on critical health care funding. Home care keeps our loved ones, our seniors, and people with disabilities safe, supported, and living with dignity in their homes and communities. Everyone wants that, especially as Pennsylvania's population ages rapidly. But the demand for our home care is outpacing the supply of caregivers. If we don't act now, we risk letting our entire system fall behind. We need long-term, sustainable investment to ensure quality care and fair support for the workers who provide it. One of the best models we have is the participant-directed home care. It allows individuals to hire someone they trust, often a family member or friend, as their caregiver. It's personal, it's efficient, and every dollar goes directly to the care of the person, not an agency or middleman. It would take just $21 million, a tiny fraction of the state budget, to raise every one of these workers above $15 an hour and give them paid days off. That's a small investment with a big impact. We need Senate Republicans to come to the table with realistic solutions to finish the job and stand up for the families, caregivers, and communities who are depending on them. Let's get this budget done. Let's make sure it invests in home care and the services that matter most. Thank you.
We have a statement from another champion in the legislature, State Senator Marty Flynn, whose district is we're in right now, but unfortunately was not able to make it. Thank you, Jennifer and Victoria, for coming. But he did send a statement on his behalf, which I will read now. On behalf of Senator Marty Flynn, Pennsylvanians deserve a budget that invests in people, not one that flat funds critical services. Every day this impasse drags on, families, seniors, and people with disabilities pay the price. We know that home care is essential in our communities, helping our loved ones live with dignity in their homes. Demand is rising fast, and we must make sure caregivers have the support they need to keep pace. In fact, the Center for Rural Pennsylvania predicts that by 2030, the population in Pennsylvania will have more seniors than any other age group combined. One common sense step is investing $21 million to raise participant-directed home care workers above $15 an hour and finally provide some paid time off. This is not only the most cost-effective model of care, but also the one seniors and people with disabilities prefer because it allows them to choose the person they truly trust most. We must come together to pass a responsible budget now, one that strengthens home care and ensures the services our families and communities depend on remain strong. So thank you, State Senator Marty Flynn. I'd like to bring up our next speaker, who is Mark Shaffer. He is the Eastern Regional Organizer for the Pennsylvania Policy Center and for Pennsylvanians Together. Mark?
Hello, everyone. As Aaron said, I am the Eastern Regional Organizer for Pennsylvanians Together in the Penn Policy Center. My name is Mark Shaffer. I'm here today on behalf of these organizations to talk about why this fight for home care funding comes down to a very simple truth. $21 million is not just the right thing to do, it is the smart thing to do. And in the scope of the state budget, it is a tiny thing to do. Pennsylvania's budget this year is about $50 billion. In that context, $21 million is less than 1/20th of 1% of the total budget. It's a rounding error in Harrisburg, but for home care workers and the families who depend on them, it would be life-changing. With this investment, every participant-directed home care worker in Pennsylvania would finally earn more than $15 an hour. They would finally have paid time off, something most of us take for granted, but that these essential workers have never had. And because participant-directed care sends every dollar directly to the caregiver and the person receiving care, no middleman, no insurance company takes a cut out of this money. This is one of the most efficient and effective uses of public dollars you will find anywhere in our budget. That is why Governor Shapiro included it in his budget address. It's why families and workers have been raising their voices across the state, and it's why the legislature has no excuse to delay or trade this away. Because here's the reality. Every day the budget is delayed, Pennsylvanians pay the price. Families can't get the care they need, workers struggle to stay in this profession, and our communities grow more unstable as the need for care outpaces the supply of caregivers. This investment is not about numbers on a page. It's about whether Pennsylvania is ready to meet the needs of an aging population, whether we are serious about stabilizing the workforce that makes independent living possible, and whether we recognize that dignity for workers and care for families go hand in hand. For a state with a $50 million budget, $21 million is not a heavy lift. It is one of the smallest, smartest investments Harrisburg can make, and it will pay off many times over in stronger families, healthier communities, and a more sustainable care system. So today, we call on all our elected officials, get this budget done. Pass the $21 million investment in participant direct home care and show Pennsylvanians that when it comes to care, Harrisburg has its priorities straight. Thank you.
Some other really strong allies here in northeastern Pennsylvania who have stood with working families and home care workers and union members for many years. I'm first going to pass it over to Frankie Malacaria, who is a member leader for NEPA Stands Up. Frankie?
Hello, everyone. I'm honored to be here. I'm honored to be here and stand with our healthcare workers in our community. I was pulled in a little bit late to this event, so my remarks aren't prepared. But my mother is a home healthcare worker, along with my sister. So I didn't feel it was too necessary. This is something that directly impacts my family. My uncle is a veteran of the Korean War, and he lives with us. And he is 100% disabled by the Veterans Association and receives home health care. Having, to see my mother and my sister, have to work multiple jobs, multiple cases in order to make ends meet, isn't something that we should be doing in this country. As Aaron said, Pennsylvania is increasing as a percentage of our population, our elders, and not only in Pennsylvania, but specifically in Northeast Pennsylvania, this is outpacing significantly other parts of the state. So we have a rapidly increasing population that is going to be requiring more and more care in the future. And if we do not allocate the funding that is necessary for it, many people will die. It's unfortunate that healthcare has become an industry, but in the system that we are in right now, the moment that we're in, we gotta pick our fights, and the fight right now needs to be at the state budget. We need to get funding past $21 million, as Mark said, is just a drop in the bucket, and would significantly impact the lives of not only the healthcare workers, but the people that they are serving. Because when you're better paid for your labor, you're able to not have to deal with as many stresses at home. So when you come into work, you're able to be, give it your all. So not only does this, a reason for on a humanistic level, but if they even want to increase productivity, it would be best for them to, pay the fair share of what the workers deserve. So with that, thank you very much, and we will keep fighting for the workers in our community that keep our community safe and healthy. So thank you.
Thank you, Frankie. I wanted to welcome up another strong partner to home care workers and a champion on this issue and for the rights of workers in northeastern Pennsylvania and working families. I wanted to invite up Andrew Payne, who is the Northeastern Pennsylvania Regional Organizing Director with For Our Future. Andrew?
My name's Andrew Payne. I'm the Northeastern Regional Organizing Director for Our Future, and we're here today to support our home healthcare workers like Krysten and like Frankie's mother, and to call on the legislature to pass a fair budget that invests in crucial social infrastructure and invest in the people that make this Commonwealth such a great place to live. Home care workers are not asking for a lot. They're asking for $21 million to raise their wages to $15 per hour and provide paid time off. These are benefits they do not currently have. I did the math. $21 million is $1.61 per person in the state of Pennsylvania. That's pocket change. That is half a gallon of gas. That is less than a cup of coffee. It is not a lot when it's all said and done. Yeah, speech went away. They're not asking for the world. They're asking for the bare minimum. And it's high time we give it to them. They are what makes this Commonwealth such a great place to live. And it's high time for legislatures like Lisa Baker to, vote in favor of them and support people like Krysten and like Frankie's mom. And I want to thank you for that.
Thank you. Thank you, Andrew. I know we're all hot here in the sun. We have a couple more speakers. Thank you all for hanging in. And I also know we have some press in the audience. We can put you in touch with home care workers for interviews in just a moment. I wanted to pass it over, though, to, again, another strong ally and advocate here across northeastern Pennsylvania who has stood with our union and home care workers for many years, and that is Alisha Hoffman-Mirilovich. She's the Executive Director of Action Together, NEPA.
I'm here today on behalf of Action Together NEPA to show support to home care workers and SEIU healthcare. Every time we turn around, there's a new cut to our healthcare. A new threat to our friends and families who need care, whether it's Medicaid cuts to give tax breaks to the rich, urban and rural hospitals facing reduced services, or areas that already have limited access and losing their only clinic. But folks in NEPA are struggling to find care that they need and deserve, and our families deserve better. Home care is essential to keep our loved ones, seniors, and people with disabilities living, participating, and aging with dignity in our own homes and communities. Most people know someone who has benefited from a home caregiver at some point. I had a friend, Martha, who was able to stay in her home because of home caregivers at the end of her life. It was stressful enough after finding out that she had pancreatic cancer and only a few weeks left to live. Martha was able to stay in her home thanks to her Medicaid coverage and her home caregivers. I can think of many more instances in my personal life where people close to me have needed in-home care, my mother-in-law, myself after a car accident, and many more. I've seen and experienced the difference that staying in someone's home can have, not just on the person who needs the care, but also on their loved ones. The need for home care services is already outpacing the supply of caregivers. We must invest now to ensure a safe, sustainable system for home care throughout the Commonwealth. These workers deserve the world. They care for us, they care for our loved ones, for our neighbors. They do it for a fraction of the respect and a fraction of the pay that they deserve. $21 million is a tiny amount in the scope of the state budget, which we have heard from multiple folks so far. And it is more than enough to bring every participant-directed home care worker above $15 an hour for the first time in Pennsylvania history, and to give those essential workers their first paid day off ever. We're calling on our elected leaders in Harrisburg to pass a budget. Every day the budget is delayed, Pennsylvanians suffer. Action Together thanks legislators like Representative Kyle Donahue and Senator Marty Flynn for their dedication to getting a budget passed for our Pennsylvania's families, to keep our schools and our transit, our families, and our caregivers going. Thank you.
So we're going to come in for a landing here. We wanted to hear from another participant-directed home care member, David Blyler. Dave? Oh, I'm sorry, Dave. Come on up, Dave. Thank you, brother.
I'm from Scranton, Pennsylvania. I'm a father, I'm a husband, I'm a caregiver. I'm also a Marine Corps veteran. I got into home care because I love my daughter. She has epilepsy. Can't tell from looking at her on the outside, but on the inside, it's total fog and chaos. You never know when the next seizure is going to occur. Everything she can't do for herself, I get to do. I supply her financial support, medical support, and her logistical support, and everything else she can't do for herself. I fill in the cognitive gaps. I'm the one that's holding her there when she's turning blue during a grand mal seizure, keeping her alive, preventing her from choking on her tongue. I've been taking care of her since she was 8 years old. 8 years old. I did before that. It's just because it's what parents do. Now, the last couple of years I've been getting paid. She's 27. There's a big difference in the math there. As a home care worker, I love being there for my daughter. It's the absolute best feeling in the world, knowing that no one else can provide the care I can to my child. I did it for a long time because, well, simply, it's the right thing to do. Parents take care of their children, end of discussion. That's the way I feel about it. A challenge I face as a home care worker is I now make less money than I used to. I wore many hats before. I'm a well-educated person, I have a lot of experience. But now I'm making less than what the kid at McDonald's does, who's working part-time. Shame. Absolutely. Caregivers like me deserve a raise. What a raise means for me is not having to worry about my truck falling apart, running out of gas, constantly having the utilities in my home shut down because we can't keep up with the food. We can't keep up with the utilities. We're living paycheck to paycheck, hand to mouth. Maybe I can even afford a new car instead of driving that 25-year-old thing. You know, it's quite eye-catching, but honestly, it's falling apart. It's just being held together at this point with bubble gum. Now, last week, Senator Rosemary Brown, she did not vote for people like me and the rest of my co-workers here. She did not vote for a budget she only voted for a budget that maintains the status quo. Now, we can all do math. Voting for a status quo equally effectively means we are taking a pay cut and doing more work. This is not shrinkflation we can afford to eat. That's right. Senator Brown's not doing her job. Politicians, they should be doing what is in the public's best interest. Not showing up to your job shows very poor character. In the military, this would be called dereliction of duty. She'd be brought up in charges. By not representing her constituents, by not doing her job, she is absolutely derelict of her duty. She did not vote for what is in our best interest. Now I'm standing here before you as a caregiver, proud union member. Because one voice, my voice, even though it's loud and clear and as bold as it is, cannot do it alone. I need the rest of everybody here standing up with me, saying the same thing. We need an increase. We need quality of living. We need a basic decency of life.
Yeah, that's right.
Now, like I said, when we're standing here, just one-on-one, they're not going to hear us. Now that we're in their face, let them try and not hear us. Let them try not hearing our voice.
That's right.
That's right.
That's right.
All right. Aaron, you got anything else to say? I'll plug the microphone to you back into it.
Thank you, brother.
Powerful stuff, and he's absolutely right. Oh, sorry, he's absolutely right. We cannot let up. And I am so honored to be joined by so many strong speakers and allies and advocates for healthcare and for working people across northeastern Pennsylvania today. Thank you so much for being here. And go somewhere cool and cool off, get out of this sun. But do not let the fire in your heart and in our bellies cool off to get this budget done, because every Pennsylvanian, every home care worker, every person who needs care in Pennsylvania is counting on it and depending on it. And we are not going to stop until this budget gets passed, because we must raise up home care. Raise up home care. Thank you. Thank you, thank you.
We're asking everybody to call your state representative, call your state senator, and tell them Pennsylvania is counting on them to get a fair budget passed immediately that includes investment in home care.